Hi, Jan Schakowsky here. I'm sitting at my desk in my office in the Rayburn room, and I'll be going to the floor soon for this big vote on the Republican repeal and replace of Obamacare. And I am a hell no on the vote. And right now, it's looking like more and more Republicans are saying no. I don't want to bet my house in the district on it, but I think that there's a good chance that it will go down, but we'll see. I wanted to really start by saying thank you. Thanks to all the people in my district, and thank all your friends beyond the district, anybody who's watching that made a phone call to members of Congress and said, do not vote for this piece of legislation. It really has had an effect. When you listen to the reasons that my Republican colleagues are saying that they're not going to vote for it, they're citing the fact that they have gotten so many calls and letters and that they know that the people in their district are not liking it. And so if anybody didn't think that the resistance really works, I think today, win or lose, is an example of how very, very important it really is when you get involved in what's going on here in Washington. And also, this whole debate was an opportunity for people to really understand about Obamacare, the good part and the not so good part. If this bill goes down, then we're going to have to be about the business of how we sit down, if we can get our Republican colleagues who've been trying for 7 years, to sit down and actually make it work better so that it's good for everyone. Well, there was a poll yesterday. It's called the Quinnipiac poll, and it found that a grand total of people who support the Republican bill is 17% of voters in our country. 17%. In this hyper-partisan environment, it's pretty amazing that you get such a consensus among Americans that their bill is really bad. And we have seen group after group. There's not a single health provider type. For example, the American Medical Association, the American Nurses Association, the Hospital Association. I've got all the disease groups say this is a really bad bill. Diseases are a big winner in their group. I'm talking about the diseases themselves. If the bill were to pass, the diseases can be happy. And so there's just been this consensus that this is not a good bill. The AARP is a strong opponent, and let me explain why. AARP now starts at the grand old age of 50, so it's not just for senior citizens that we usually define as starting at 65 and older, but the people between 50 years old and 64 or up until Medicare are the big losers in this legislation, because there is what we're calling, and it truly is, an age tax that is put on those individuals. What that means is that people in that age group can be charged 5 times as much for their health insurance than the young people in our country. And so no wonder that people are opposed to it. If you happen to be a person who makes $26,000 a year, what you're paying now is still a pretty hefty, that is under Obamacare, $1,700 a year. If you saw the passage of this legislation, that goes up to, what is it, Amy, about $14,000 a year? $14,000 a year. I'm talking about someone making $26,500, that's what they will pay a year, $14,000. No wonder the Congressional Budget Office says that most of those people who make under $30,000 a year, that the uninsured rate among those people will double before long. Because who can do that? Nobody can do that. And that's just one of the bad things. 24 million Americans will be thrown off their health care. That's what the Congressional Budget Office, they appoint the head of the Congressional Budget Office, that is, the Republicans do, And that's what they're saying. 24 million people. Actually, at the end of the day, it's more than 50 million people, but in the next few years, it would be about 24 million people would lose their health care. And people who have continued to have health care would get less coverage and pay more and get less. It also steals from Medicare. The Affordable Care Act, Obamacare, actually extended the life of Medicare Trust Fund, of the Medicare Trust Fund, for 11 years. This legislation would decrease it by 3 years. You know, it's terrible, terrible for women. The Republicans like to tout their bill by saying, this is about freedom. It's about choice. You can pick your plan, you can pick your provider, you will have all this choice. Well, obviously, they don't want to extend that to women because this bill defunds Planned Parenthood. And so women would not, on Medicaid anyway, women would not be free to be able to choose Planned Parenthood as their provider because none of the Medicaid dollars would be able to go to Planned Parenthood. In that same poll I was telling you about, when Americans realize, and of course it's true, that none of the money going to Planned Parenthood would actually be funding abortions, 80% of Americans say that they think Planned Parenthood should not be defunded. And about 75% of Americans think that Medicaid should continue to be funded. And you know, Medicaid, yes, it's true that it helps our children, it helps low-income people. 1 out of 4 births in the state, is it in the U.S. or?
50% of births in the U.S., 1 out of 4 people in Illinois have Medicaid.
1 out of 4 people in Illinois get Medicaid, and half the births in our country are funded by Medicaid. And if you're a senior citizen and you have someone or in your family that needs nursing home care or home care and relies on Medicaid, look out. Hold on to your pocketbooks because that money could be gone. So this is a really bad proposal. Most people see it. Only 12% of Americans say they think this Republican bill will make their health care better. And so this whole debate in many ways has been productive in helping people to understand the difference between Obamacare, the difference between good health insurance, real access to care, and what the Republicans are providing. They say, well, you know, promises kept. They promise. Yes, and for 7 years they've been saying they're going to repeal Obamacare. Well, they're finally at this moment, and it looks like, I'm hoping anyway, we'll see, that it's not going to happen. And at the same time, I am very much hoping that we're going to be able to work to make it better. So I think those are really the key points. Amy, anything else I should add? Geronimo, what do you think?
I think we're all good.
Got my team in here, and you know, let us know if you still have questions, if you still have comments. And by the way, thank you for your stories, because I've been sharing those stories on the floor of the House and on Twitter and etc. about the ways that Obamacare has actually been good for you. I do hear from many of you who have said, Obamacare saved my life. I had a pre-existing condition, and I wouldn't have been able to get the care that I need. So we're going to continue to fight for the best care that we can get. We're going to continue to oppose ideas that go backwards and provide women and children and families and working people and retired people in this country with the best care. That's why I ran for Congress, that I wanted to get involved in public service. I want to make sure that what Donald Trump stated as his objective, that everyone in America will be able to get health care, that's my plan, and I want to continue to work for it along with you. Thanks for everything.